Good morning to one and all. At the outset, I would like to thank KSOS for giving me this opportunity. Can anti-segment OCT biomarkers predict the future recurrences in RCS patients? RCS patient is a chronic, relapsing, severe, painful condition, and till date, nobody is happy to see an RCS patient in their OPD because there's no way to predict in whom we will have more recurrences. So the aim of our study was to study the ASOCT biomarkers in these patients and to study the capability of these ASOCT biomarkers in predicting the future recurrence in RCS patients. So this was a retrospective study, and all patients with RCS were enrolled. And at the OPD level, history was taken on the cause of initial insult, the duration, time back, and the time gap, and the frequency of recurrences. And based on the history of frequency of recurrences, patients were grouped into frequent recurrent groups, that is, patients who complained of at least one episode a month, or rare recurrence group, that is, patients who complained of an episode at least every 2 to 3 months, or complained of only limited or fixed number of recurrences since the initial insult. All patients underwent slit lamp examination, ASOCT scanning, and epithelial mapping. So the RCS area was marked in the OPD level, and a clinical diagram was drawn. And this area was then sent for ASOCT scanning. And additionally, an epithelial mapping of the entire cornea was done. And area of RCS thickening, as seen here, area of epithelial thickening was delineated as the hotspot on the epithelial map. And we tried to look at whether this hotspot corresponded to the clinical diagram, which was drawn in the OPD level. So ASOCT changes in RCS patients are seen more in the superior layers, that is in the layer of the epithelium, the epithelial basement membrane Bowman's layer complex, that is the BMBM, and the stroma. These are the common changes that we looked at. That is, the epithelial changes that we commonly noted were epithelial hyperreflectivity, epithelial detachment, epithelial edema, and intraepithelial hyperreflective inclusion bodies were seen in a few. And the BMBM changes that we noted were, as you can see with the blue arrow, a BMBM line which is seen in the other areas was absent in the area of RCS. And in some patients, the BMBM layer was hyperreflective in the area of RCS. And coming to the stromal changes, there was anterior stromal haze noted in a few. And additionally, in the epithelial mapping, as you can see with the pointed area, the area of epithelial thickening in the area of RCS was denoted as the hotspot in the study, and we looked at whether this hotspot corresponded to the clinical diagram drawn in the OPD. So 36 patients were enrolled, and more than 52.8 patients complained of symptoms for more than a year. And 69.4% of our patients fell in the frequent recurrence group. And fingernail was noted to be the most common cause for injury as the initial trauma. And we looked at our ASOCT changes. Majority of the patients, that is more than 70% of the patients, were noted to have, in both the groups, were noted to have epithelial and BMBM changes, and stromal changes were noted only in a few. So we went ahead and compared these changes between the frequent recurrence and the rare recurrence group. And even though epithelial and BM changes were seen in majority, only BMBM changes were noted to be statistically significant between the two groups. So what does this mean? This means that the BM changes is more frequently seen in the patients complaining of frequent recurrences, and the occurrence of this on ASOCT could probably indicate that this patient will have more recurrence in the future. Then we looked at the ASOCT epithelial map changes, and the hotspot was seen in more than 90% of the patients with RCS. And not only was it seen, it also corresponded to the clinical diagram which was drawn in the OPD. But when we compared it between the two groups, there was no significant difference noted between the two groups. So it indicates that this could just delineate the area probably, but not be a predictor of future recurrence. So RCS, as we know, is a chronic relapsing condition, and it is painful. And a fingernail injury noted in our study corresponds to other studies as well. And our ASOCT finding of BMBM changes is a non-invasive way of what we already know, that the culprit is at the epithelial basement membrane adhesion complexes. And ASOCT changes have been studied in the past. This is a study where they looked at the ASOCT changes in an acute and chronic patient. In acute, as we can see from the first picture, they saw epithelial breaks, whereas in chronic patients, they saw these intraepithelial inclusion bodies, loss of BM at the spot. But ours is the very first study to compare these changes between the two groups, and also try to identify a change which is more commonly seen in a frequent recurrent erosion group. So though in our study, both epithelial and BMBM changes were noted in more than 70% of the patients, BMBM changes was the only change which was seen more commonly in frequent recurrence group. And this could probably in the future delineate patients with higher recurrence rate. What does this signify? This signifies that till date, slit lamp examination is the only way that recurrent corneal erosion patients are followed up. And this is highly inadequate in prognosticating the patients. Our study agrees with that ASOCT can delineate the area of RCS well, but this cannot predict the future recurrences. So historically, slit lamp examination was used to document epithelial changes, but our study has proven this is highly inadequate in prognosticating patients with RCS. And imaging has revolutionized many treatment and it helps in better prognostication. So we would like to move from slit lamp examination to epithelial mapping to delineate the area well, and on ASOCT scanning, try to identify whether it's epithelial BMBM or stromal changes. And if BMBM changes are noted, go in for an early surgical intervention rather than waiting. The limitation of our study is that it's retrospective nature and it's small sample size, but this is just a pilot study and a prospective arm is underway. This is the first study to categorize the predictors of recurrence using modern imaging, and we would like to take this further. This is my references. Thank you so much.
That's very interesting. I, so in terms of the time that you took the image, how long was it after the erosion happened?
So all these scans have been taken at acute presentation when the patient presented to the OPD, and this is not.
So was it
The prospective arm is underway.
yeah,
This is the
so was
retrospective.
it all on the same day?
Yes, sir. All on the day of presentation.
All on the day of
On
present.
the day of presentation.
So how did you I mean, you're talking about hyperreflectivity and
Yes,
you're
sir.
talking, was there any way you quantified that in the sense, because this is it's a subjective variable, so was there
That's
any
it.
way you quantified that?
That's an interesting suggestion, so probably we will look into it in the prospective arm. We didn't really quantify it. We just looked at its presence and absence only at this
Yeah.
point.
So I think, see, because that is where the whole thing becomes a little
Okay.
tricky. You should quantify it, or you should have a set of standard images with which you compare it.
Yes, sir. We would look into that prospective arm. Sir, at this point, we have just looked, these are just at acute presentation. In the prospective arm, we are planning to look at the different modes of treatment. We have,
You
we have,
not looked at the post of
at this point in this particular study, not yet, sir. Yes, ma'am. Can I have the slides, please? Um, I'll just show it to you, ma'am. 1 second. In the age, mean age was 35.7. Thank you. Thank you so much. Yes, ma'am. No, ma'am, this whole classification, yeah, this for the study because we wanted it to be as reproducible as possible. Something like a classification like this can be done in an OPD and can also be reproduced by others. We just wanted to keep it simple based on the history alone and not complicate it too much, just to make the study more reproducible. Thank you.